My name is Susan Nyagaresi Bitengo. I am a doctor of naturopathic medicine candidate and a functional medicine consultant and a gut health expert. Let's dig in and see what H. pylori is and how to treat it. Welcome to this session from surviving to thriving. Now, H. pylori is the most successful human pathogen in human history, says Dr. Martin J. Blasser, a renowned expert on H. pylori. Why? Why is it the most successful pathogen in human history? Because 2/3 of the world population are infected by H. pylori. In an article by the World Health Organization, it also states that more than 50% of the human population are infected by H. pylori. Now, it has staggering numbers. 20% of the people that received treatment reported experiencing those symptoms again. But the most staggering numbers are in misdiagnosis. It says that it is among the most misdiagnosed diseases. Why? A study published in the Journal of Clinical Gastroenterology found that H. pylori infection was misdiagnosed in 34.6% of patients. Another article by the World Journal of Gastroenterology also found that the misdiagnosis rate for H. pylori infection was 41.7%. That is almost half of all the tests that are conducted. That makes it one of the most highly misdiagnosed diseases. A gram-negative bacteria has 2 cell walls as opposed to a gram-positive bacteria. H. pylori cell wall, it makes it resistant to drugs and thus makes it hard to kill by antimicrobial drugs and herbs. H. pylori mostly or largely lives in the oral mucosa in your mouth, so it is easily transmitted through sharing cups or plates and feces in mostly developed societies. Developed and developing societies, H. pylori is transmitted through drinking water and poor economic living conditions. Because it's gram-negative with 2 cell walls, it also colonizes highly acidic gastrointestinal tract and the vaginal cavity. Because of that, it therefore may be transmitted through vaginal fluids. Hence, it is recommended that anytime you have a positive patient who has H. pylori and they have a partner and they are a lady, it's good to have the partners undergo testing and treatment simultaneously to avoid reinfection. H. pylori releases an enzyme called urease. Now, urease neutralizes the stomach acid. By neutralizing the stomach acid, it causes low stomach acid, or a condition called hypochlorhydria. Normal stomach acid should be between 1.5 to 3 pH. But when you have hypochlorhydria, the stomach acidity is more than 3, and that condition results always in low stomach acid. If you have low stomach acid, you're probably going to experience improper digestion because your digestive system will not break down food properly, especially proteins and fat. You will also won't be able to absorb nutrients, ultimately developing nutrient deficiencies. And your nutrient deficiencies are going to be in vitamin C, vitamin A, vitamin B12, and folic acid. For example, you're going to find food just sitting in the stomach after you take food. It feels like there's no activity following an intake of a meal. So you don't feel like any digestion process is going on. Then constipation or diarrhea, indigestion, undigested food in stool, malnutrition, bacterial overgrowth. It is estimated that a lot of people, more than 90% of people that are infected with H. pylori are not going to experience any identifiable symptoms. So what are you going to look at? You're going to look at bloating, gas, indigestion, constipation or diarrhea, dysbiosis, and then you're going to have low stomach acid. You're going to have nutrient deficiencies. You're going to experience neurological issues because there is inflammation of the nervous system by H. pylori, such as these symptoms will be like mood swings, anxiety, depression. Only 10% of H. pylori patients develop ulcers. Again, only 10% of H. pylori patients develop ulcers. But then there are estimations that show that more than 80% of gastric ulcers and 90% of duodenal ulcers are as a result of H. pylori infection. Whenever you confirm that a patient has hypochlorhydria and you suspect that it's caused by H. pylori, there are a couple tests that you're gonna consider. And conventionally, what we know, they will do a CBC or complete blood count, comprehensive metabolic profile or CMP, iron panel, thyroid panel, B12 level, and intrinsic factor.